Welcome to the Deep Dive. We're here to cut through the noise and get straight to what matters. Today we're doing a deep dive into something really timely, really vital. The whole landscape of mental health services, the costs, and your rights as a patient, specifically in New Haven as we're moving through 2025. Our goal really is to take all these articles, the research, the notes you've shared, and just boil them down to the key things you need to know. Expect some maybe surprising facts and definitely some actionable insights that can help you make choices. Okay, let's unpack this.
Yeah, and it really feels like the right moment for this kind of conversation. Awareness around mental health in New Haven, it's hit unprecedented levels. We're seeing more residents than ever, actively looking for support. So this chat should give you a pretty comprehensive understanding of how individuals, couples, families, how you can find evidence-based treatments and support systems right there in New Haven. It's about giving you that clarity, really, to navigate this essential part of well-being.
Right. So to start us off, let's kind of set the scene. Talk about this evolving landscape of mental health care there.
Yeah.
The sources we looked at, they definitely point to this big surge in awareness, like you said, and more professional therapy options being available. So when we talk about the popular services, what are some of the main approaches really making a difference now?
Absolutely. The sources break it down into a few key areas. So for couples and marriage counseling, the main goal is strengthening the relationship. It's about improving communication, resolving conflicts better. And therapists are using really established effective methods like emotionally focused therapy, EFT, and the Gottman method.
Oh,
These aren't just, general chats. They're structured ways to tackle common stuff like trust issues or communication breakdowns.
Gotcha. So it's about using specific tools, not just like a vague conversation. Makes sense.
Exactly. Precisely. Then you've got really solid support for anxiety and depression. The aim there is helping people manage symptoms, obviously, but also really improve their quality of life day to day. Methods vary, but you see things like cognitive behavioral therapy, CBT, which is pretty well known, also mindfulness-based stuff and other specialized techniques depending on what someone needs.
And what about for maybe more deep-seated experiences, things like trauma? How do services deal with that?
Right. For trauma and PTSD treatment, the focus is really on addressing those lasting effects from traumatic events, but in a safe, structured way. Specialists use methods like EMDR, that's eye movement desensitization and reprocessing.
Right, heard of that.
Yeah, and trauma-focused CBT, somatic experiencing techniques too. These are all designed to help actually process the difficult experiences, not just talk about them, to kind of integrate them healthily. Anger management is another key one. Teaching healthy ways to understand and control emotional responses often uses cognitive behavioral techniques like identifying triggers, finding coping mechanisms, that kind of thing.
And something that's clearly been, well, a game changer for a lot of people, especially recently, is online therapy being so common in New Haven now.
Oh, absolutely. It's really transformed access. Online therapy offers super convenient, accessible care right from home. You get licensed therapists, secure video sessions, messaging support. The key thing is it fits into busy lives, but keeps all the professional standards you'd expect from seeing someone in person.
Okay, here's where it gets really interesting for a lot of listeners, I think. Understanding what's out there is one thing, but the practical side, the cost, how insurance plays into it, that's often where people get stuck. It's so crucial for making, truly informed choices. So what's the data actually telling us about typical costs and insurance coverage in New Haven?
Well, what's fascinating here is how detailed the breakdown is in the sources. It gives a pretty clear financial picture. For standard individual therapy, you're generally looking at a range of, say, $120 to $280 per session. The good news, it's covered by about 90% of insurance plans. Typical copay might be $20 to $40. Sessions are usually like 45, 50 minutes, often weekly, and availability seems pretty high.
And for teens, are the costs similar?
Often a little less, yeah. Individual teen counseling, maybe $110 to $250. Covered by about 85% of plans, copay around $20, $35. Sessions are 45 minutes, weekly, also high availability. For individual ADHD therapy, the range is more like $120 to $270. Covered by 80% of plans, copay $25, $45. Sessions are 50 minutes, maybe biweekly, and availability is listed as medium. And individual trauma-focused therapy, that ranges from $130 up to $300. Covered by 85% of plans, copay $20, $40. Sessions are a bit longer, 50, 60 minutes weekly, also medium availability.
Okay, so far, pretty good coverage across different individual needs, it seems. What about therapies involving more than one person, like couples or family counseling? Same kind of pattern.
This is where we see a really significant, important difference. Couples counseling, the cost range is $150 to $350. But, and this is really key, the insurance coverage is limited. Only about 30% of plans typically cover it.
Wow, only 30%.
Yeah, and the copays are generally higher too, like $40 to $80. Sessions are longer, 60, 90 minutes, maybe biweekly, but availability is high. For family therapy, it's a bit better. $140 to $300, covered by 75% of plans, copay $25, $50, usually 60 minutes weekly, medium availability.
That limited coverage for couples counseling really jumps out, especially when individual therapy seems, mostly well covered. Is there a reason for that, like a historical thing or a policy reason why relationship care gets less insurance support, even though, healthy relationships seem pretty fundamental to mental well-being?
That's a really crucial point. Historically, yeah, insurance models often focused on diagnosing and treating an individual's illness. Things like couples therapy were sometimes seen less as a medical necessity for one person and maybe more like life coaching or relationship improvement.
Oh, I see.
So it made it harder to fit into the standard medical coding and billing systems. But there is a growing push now to redefine medical necessity to include relational health because everyone recognizes its impact on individual mental health. It's definitely an area where advocacy is ongoing.
Okay, that adds really important context. It's not just some random quirk in the data, it's systemic.
Exactly, right. Moving on, group therapy is much more affordable, $40 to $80 per session, and it's covered by 95% of plans, which is great. Low copay, $10 to $25. Sessions are 60, 90 minutes weekly, medium availability, and online therapy, which we talked about, $80 to $200. Covered by 90% of plans, copay $15, $35, sessions 45, 50 minutes, flexible scheduling, high availability.
That is an incredibly helpful breakdown of the money side of things. And the sources also clarify what those coverage percentages mean, right? Which helps you figure out the options.
Yes, exactly. So most plans mean 75% or more coverage. That suggests pretty wide acceptance, reasonable copays for you. Some plans is 30% to 75% coverage. That might mean more limited coverage, maybe higher out-of-pocket costs. And limited plans that's less than 30% coverage usually means it's mostly self-pay. For the absolute full details, the Connecticut Insurance Department is always the go-to resource.
Okay. And beyond cost per session and insurance, what about how long someone might typically be in therapy? Is there an average duration?
Well, it varies a lot, obviously, depending on individual needs, the complexity of what's going on. But generally, short-term therapy might be 8 to 12 sessions, often good for anxiety or very specific issues. Medium-term could be 12 to 24 sessions, maybe for depression or more involved relationship stuff. Long-term therapy can be 24 sessions or more, usually for trauma or complex conditions needing deeper work. And then there's ongoing support, which might just be monthly check-ins to maintain progress.
That helps set expectations. Are there other ways to pay in New Haven besides just insurance? For people maybe without great coverage or who prefer not to use it?
Oh, absolutely, yeah. Besides taking the major insurance plans, Blue Cross, Blue Shield, Aetna, Cigna, United Healthcare, Medicaid, many providers in New Haven really try to make care accessible. They often offer sliding scale fees, for instance. Those are based on income, offering reduced rates, maybe $50 to $120 a session for people who qualify.
So affordability is definitely something providers are thinking about.
Yes, definitely. And you might find self-pay benefits too, like a 10-15% discount if you pay upfront for a block of sessions, package deals, sometimes student or senior discounts. Payment plans are often an option, monthly installments. And using HSA or FSA accounts for qualified medical expenses is common. And crucially, check about employee assistance programs, EAPs. Many New Haven employers offer these. They can provide maybe 3 to 8 free therapy sessions as a benefit. Always worth asking your HR department about that.
That's incredibly useful info for anyone trying to figure this system out. Let's shift gears a bit to the legal side, because the laws and standards, they play a huge role in protecting patients, right, and improving access. What does the legal framework actually look like in 2025 for mental health services in New Haven?
Yeah, if we connect this to the bigger picture, the legal framework in 2025 is pretty robust. It's designed to ensure, fair access and patient protection. A key thing is that New Haven follows the federal mental health parity requirements very clearly. What that means, legally, is that mental health treatment must get the same level of insurance coverage as physical health services. It basically eliminates those old discriminatory practices that used to limit access to care.
That sounds like a really significant step forward, truly. Are there still challenges, though, even with parity laws, or common pitfalls people should maybe watch out for when dealing with their insurance?
It is a huge step, absolutely. But yeah, challenges can remain. Sometimes navigating the specifics of your individual plan can still be tricky. Deductibles, out-of-pocket maximums, those still apply, just like for physical health. And while Parity says coverage must be equal, it doesn't always magically create enough in-network providers immediately. So finding someone available in-network can still be a hurdle sometimes.
Right.
But the legal backing for equal coverage itself, that's solid now. Another big development is around telehealth rules. New Haven really expanded telehealth access for mental health in 2025. This means you can see licensed therapists through secure video platforms, and insurance have to cover it fully. That makes care way more accessible, gets rid of geography issues, transport problems.
And privacy, that's always a big one. You're talking about something so personal. Mental health records.
Absolutely crucial. Patient confidentiality and rights are strictly protected under IPES, plus state regulations. All your therapy sessions are strictly confidential, period. Therapists can only share info if you give written consent or in very specific, legally defined situations, mostly involving immediate danger to yourself or others or certain kinds of mandatory reporting. Beyond that, there's a strong focus on licensing and professional standards. Every therapist in New Haven has to be properly licensed. That means extensive education, supervised training, ongoing professional development. It ensures quality care. And finally, just to loop back to cost, the 2025 insurance rules specifically lock in that mental health coverage parity. So most major insurance plans are required now to cover mental health with reasonable copays and deductibles. That directly makes therapy more affordable.
So what does this all mean for you, our listener? Let's tie it together. We've talked about the wide range of services available in New Haven: individual, couples, trauma care, online options. We've tried to demystify the costs, showing how insurance generally covers individual therapy well, but highlighting where it's trickier, like with couples counseling. And we looked at all those payment options designed to help bridge the gaps. And just now, we covered the strong legal protections in place as of 2025: parity laws for equal coverage, strict confidentiality, expanded telehealth. It really paints a picture of a system that's evolving, trying to better support residents, giving you more clarity, more options than ever before.
Right. So thinking about all this, the increased awareness, this robust framework now in place in New Haven, maybe the question to ponder is, what does truly accessible and effective mental health care look like for you personally? And how does having this detailed understanding empower your next steps, whatever they may be, in a world that's thankfully becoming more open about talking about mental well-being?